Hi, everybody. My name is Susan Flanagan, and I am the Director of Disaster Services, and I am honored today to have a conversation with my dear friend, Dr. Angeline Stanislaus, whom you all know is our Chief Medical Officer at the Department of Mental Health. How you doing, Angeline? It's good to see you.
I'm doing great. Good to see you too.
I know, even though we're both in St. Louis right now, I mean, we're together on screen, but we're pretty far apart. But, you know, it's been about a year since this pandemic has been going on, and we've been responding, and I am very pleased with how the department has worked hard to keep our clients safe, our staff safe. But it seems like the information about the pandemic is fast and furious. So I'm really pleased that you could take some time and answer questions about the vaccines that have come out. So we've been hearing news about the vaccines. There's more than one. And I know that you're very schooled up on that, but let's talk a little bit about that, because I know there's two vaccines from Pfizer and Moderna. Is that the other one?
The other one is Moderna.
Right. And I know that scientists globally have looked at COVID-19 ever since it's come out. They've done what's called mapping the genome, where they've actually been able to get it down to a level where researchers in different pharmaceutical companies across the globe, and even right here in St. Louis, we've had some trials and tests with a Pfizer unit here. And so this is December 18th, and so the vaccines are rolling out. And hopefully we'll be getting ours soon. But we thought we would take time to talk about how the vaccines were developed, and we thought we'd do 10 questions in 10 minutes. How does that sound?
Sounds good. That sounds good? Great. Yes.
Okay. I know the FDA approved both of these vaccines. So on our original conversation, we were only talking about Pfizer, but Moderna just got approved. So do you know when DMH staff and clients will have access to either of these vaccines?
It should be pretty soon, Susan. So there are multiple ways to get the vaccine, some through the federal government and some through the state government. And we are pursuing both through the federal and through the state. And we are next in line to get these vaccines. And we should be, within the next week or two, we should be able to get vaccine in our facilities and in the arms of our staff and our patients.
Wow, that's pretty great, because that would put us into December, first part of early January 2021. So who should get vaccinated?
The recommendations are that the people who need to get vaccinated for sure are healthcare professionals who have direct patient contact, and what we call the patient-facing healthcare professionals. And also individuals who are at high risk for COVID-19 illness. So there are certain medical conditions that if you do get COVID with those medical conditions, you're much more likely to have a negative outcome, such as a much more prolonged illness, or a lot of consequences, a lot of side effects, a lot of consequences from the COVID, and sometimes, unfortunately, it could be death as well. So those individuals who are deemed as high risk will be the second in line. People who are 65 and older are third in line, and then workers in essential and critical industries also. So these are all the priority list for those who need to get vaccinated as per the federal government.
Oh, okay. Well, that's good to know. And I know that we can visit the CDC website and others that have more information about this. But I know not only should some people get it, but some people should also possibly wait. And who would be candidates to wait?
So one of the things is that one of the difference between the two vaccines, one is the Pfizer vaccine and the Moderna vaccine. The Pfizer vaccine is approved for children 16 and up, whereas Moderna vaccine is only approved for 18 and up. So those who are 16 and below, or 18 and below, depending on what vaccine is available, those individuals will have to wait until we know more of the safety, and at this point it is not approved by the emergency use authorization for that age group. Pregnant women, again, there are not too many people in the studies with the pregnant women when they did the trial. But it again, you have to weigh the risk and benefit. The best
Sure.
person to have that conversation would be with their gynecologist or their OB or their primary care doctor to really discuss. Sometimes if you get the infection, you may have a much more worse outcome, and even not knowing how safe it is for pregnant women without the trial, because of the trial data, without much trial data. So that is a conversation you need to have with your doctor. And then there are some immunocompromised medical conditions, such as people taking immunosuppressive medications. Again, you got to weigh the risk and benefit, because those individuals are also at high risk of getting COVID. So definitely, I would engage in a conversation with the physicians to help make that decision.
Yeah, no, that's a really good idea to do that. And we've been keeping up to date on it. It's different how they administer it, but how is the shot actually given? I mean, I assume it's a shot.
It is a shot. So there are two vaccines. The Pfizer vaccine, it has to be kept in very special cold. There's a chain of cold storage and those kind of things. So it's usually two shots for the Pfizer vaccine. You have the first shot on day 1, and then you have the next shot on day 21. So it can be 21, 22 days, but 21 will be ideal. For the Moderna vaccine, it's a shot. You get a shot on your arm on day 1, and then the next shot, the second shot, is to be scheduled on day 28. So that is one of the differences between the two vaccines that we have. But you have to have 2 shots in order to get the full protection.
So Pfizer, it's 3 weeks, and Moderna, it's 4 weeks, essentially.
4 weeks.
That's easier for me to remember it that way.
Correct.
So I understand that with the Pfizer shot, that the protection goes up with each shot. Is that right? Like there's a percentage of protection?
That is correct. It's both with Moderna and with Pfizer. When you get your first shot, the body starts producing the antibodies or the immune mechanism, and you get about 50% protection. By the time you get your second shot, and perhaps a few weeks later, for Moderna, they say about 2 weeks later, that protection increases to more than 94 to 95%.
Wow, that's really high.
Yes, so you really do need the 2 shots, and you get much fuller protection, which is like 94 to 95% after the second shot.
Right. So I know that we will make these available when we get them, but will our staff be required to take this shot, this treatment?
We cannot mandate people to take the shot, but the decision one has to make is, this is definitely has a trial. This has been, it's a vaccine to boost the immune response to the COVID virus itself. The risk of getting the COVID virus and having quite serious consequences, including death. Comparing that to taking a vaccine that can produce an immunity and prevent you from getting infected with the virus and perhaps having the long-term consequences of it. When you weigh it, it's much, much safer to have the vaccine. So I would strongly encourage our staff to take the vaccine. I am getting it the first opportunity I can. My husband, who's a physician, is getting it the first opportunity he can. And my daughter, who is trained to be a physician, she got hers today. So,
oh wow!
And she's only in her 20s. So it is very, very important that we get the vaccine. We protect ourselves from the side effects from actually getting the COVID virus.
Right. So okay. So we've talked. There's a couple of options that will be coming out. What about side effects?
So the potential side effects are mainly local. So local and kind of a flu-like symptom. So the day you get the shot in your arm, you're going to have a little bit of redness, some swelling, and you're going to feel a little bit of discomfort at the site that you get the swelling. Sorry, when you get the shot. And then that day or a day later, you can get a little bit of a mild flu-like symptom, such as a little bit of fever, some tiredness, some body ache. nothing that a Tylenol could not handle. So typically what I recommend or they recommend is that take a Tylenol immediately after the shot, and the symptoms should wear off within a day or two. And
Yeah.
and it'll happen again when you take the second shot as well. Again, this doesn't happen to all the individuals. There are some who can have these kind of symptoms, but they are self-limiting, and they should resolve by taking Tylenol.
Right. So that's very similar to getting the annual flu shot. I mean, some years my arm hurts, some years it doesn't. So just depends.
That is correct.
So like an annual flu shot, with this, would we need to do this every year, or do we know?
That is a part we do not know, Susan, because the trial, what we do not know is we know that the body produces antibodies to fight the virus. So anytime the virus comes in contact with the body and enters our bloodstream through the receptors in our body, it will fight it so that it can't stick and multiply within our body. But what we do not know is this antibodies that our body produces in response to the vaccine, how long it lasts. The current data shows it can definitely last at least 6 months. Could it be longer? Only time will tell. But one of the mechanisms by which this vaccine acts is by actually priming our memory immune cells, so that is a long-term effect. Once the memory cells are triggered, the white memory cells are triggered, and they are given that memory, anytime they see this particular yes protein from that particular virus, they are on attack mode. So that could be much more long-standing.
Sure. Yeah. To be continued, but still it's good protection. And it's almost here. So if we get these series of shots, what about all this preventative things we've been doing, like wearing a mask, washing our hands, social distancing? Do we still have to do that?
Yes, the CDC's current recommendation is that you continue to wear your mask and you continue to also socially distance, even after you get the shot. The reason is several. One, after you get the shot, we know that the body produces antibodies to fight the virus. Now, different people's bodies might take a little bit different time by which it can produce the optimum amount of antibodies. So you really want to protect yourself till the optimal amount of antibodies is developed in the body. And that is one thing. The second thing is, because this is it also want to make sure that you, in case you have entry of the virus into your nasal cavity from being with somebody with COVID positive, and it's still multiplying in your nasal cavity, you don't want to sneeze or talk or give it to somebody else. So you will not get sick with it because your antibodies will fight that. But nevertheless, if you did enter your nose and your nasal cavity, it's best not to protect your nose as well, nose and mouth as well.
Right. All right, good advice. What about for people that may have already had COVID? Do they still need to get a flu shot?
They still need to get the COVID vaccine.
Right.
The issue really is Susan, that when individuals get a COVID infection, we do not know how long those antibodies or that immunity lasts. Some studies have shown that after a COVID infection, that some of these antibodies do tend to decrease with time. There have been some studies that have shown evidence of reinfection with another strain of the COVID virus. And hence, the best way to protect yourself against all this is to take a vaccine, to take the COVID vaccine, even if you have had tested positive for COVID.
Yeah, no, that really makes sense. And I also want to talk to you briefly just about the fact that these are incredibly stressful times for everybody. I mean, I know everyone up and down throughout the DMH system has been working extra hours trying to keep our folks safe, trying to do their jobs. It's just relentless stress that's in the community. So one thing I want to remind everyone of is that we have the Show Me Hope Crisis Counseling Program that's operating statewide, and there is a toll-free disaster distress helpline. That's 1-800-985-5990. It's operating 24/7, but you know, Dr. Stanislaus, even the times that we're around, everybody's getting pretty crispy. We've done it for about a year. It's been really, really hard. So one of the things I wanted to ask you, what would you say, just if you could summarize to our staff about the importance of getting vaccinated?
The importance of getting vaccinated is there's a protection for you. It's a protection for your loved ones. It's a protection for the ones we care for. It is a protection for everybody around us. And it's a protection for the community. If there are enough people who are vaccinated and they're not able to get sick from the virus and transmit the virus, that'll bring the end to the pandemic. So the earlier we get vaccinated, the less likely we are going to be able to get sick, or the less likely that we are going to transmit it. So really my hope is that more and more individuals get vaccinated, and the pandemic will come to an end.
Well, it's really important information to share. I really appreciate your time today, and particularly, giving the information that people need to stay safe and stay healthy. I know that we've talked about you will be doing perhaps webinars, maybe producing a couple other videos as this goes on. As we mentioned early on, this changes practically daily. So I so appreciate you being on top of everything and being our source of information. And, I love working with you. So thanks for all you do. And thanks to everybody that's watching this, the work that they do for our agency. I mean, our work is so important, and we have the greatest employees anywhere in the state.
So one thing I would say is there are going to be a lot of questions staff and their family members might have on the vaccine. At any time, if you have questions, email me the questions, send us our way, or talk to your supervisors to send it our way, and we will take a look at it and address it. And I will be glad to answer and address any questions any of our staff might have.
I love that. And I want people to know she genuinely means this. I mean, her assistant is Ronette Schulte, and if you want her to talk to a staff meeting or answer questions, again, she's available. And, again, that's why I love working with you.